It's my pleasure now to make some closing remarks and also talk about our call to action. We developed a call to action on antimicrobial resistance and circulated it to our World Federation members and to partners throughout the world. And we had over 60 responses to this of groups that have already signed up to the Global Charter and to this call, for action on antimicrobial resistance. I think that's readable from here, but I'm going to just quickly take you through it because I'll ask you to do two things. One, to, by a show of hands, approve it from this meeting, but also if you would like your organisation to be recorded on it, to write to the Secretariat at WFPHA.org and to say, can we please be included as a supporter of this call to action on antimicrobial resistance. Antimicrobial medicines have played a key role as in both prevention and cure of infections. I just need to know, if Tony, can you read that from there? So I won't, in which case I won't read every word through. So that first paragraph just gives the background, describes it, points out that Margaret Chan saw it as a matter of utmost urgency, and Tedros, the new WHO director, has also continued with that approach. The World Federation and this workshop then want to make sure that our thinking continues right across the world. Have I gone too far? No, I haven't. So in the section then, what we've done is used our global charter for the public's health, and we've used those three areas to make sure that we cover prevention, protection and health promotion, and then the second part we look at the enablers. So within these services you'll see under prevention, implementation of the Global Action Plan, and we focus quite clearly on the Global Action Plan. We talk about education and training, the incidence of infection, and the importance of sanitation and hygiene, and that has come up again and again, and also within agricultural practices, good stewardship, and optimising the use of antimicrobial medicines in human health as well as agriculture. And then in protection, supporting appropriate regulation, monitoring and surveillance, stringent environmental standards in manufacture, distribution, control and disposal, support for Food Agricultural Organisation, the World Organisation for Animal Health, so that we are looking at a One Health and environmental approach, and health promotion, apply and understand the social determinants of health, and address what Sir Michael Marmot calls the causes of the causes of the causes. He goes further, of increasing antimicrobial resistance, empowering individuals to change behaviour through improved health literacy. Then the enablers, good governance, and this has come up again and again today, improved national jurisdictional legislation, develop and strengthen cross-sectoral strategies, policies, institutions to improve action, ensure transparency, accountability, best practice, inaccurate information to increase understanding, strengthen surveillance, transparency, research, accurate information through traditional and the social media, and I know many people have been tweeting out of this workshop today and things going on Facebook, and thank you for your support on that. Commit to effective government-supported campaigns warning of the dangers of misuse of antimicrobials, and of course capacity building, and particularly through our universities and particularly through our schools of public health, effective education and training, knowledge and understandings, though they go beyond institutions and health professionals, public health driven research and development, and that's been spoken about again and again, and Herman has just reinforced the importance and different ways of doing that. Doing advocacy, improve civil society leadership, and we do have to remember that civil society has a key role to play in this area, and it's not just organisations that are public health like the World Federation, but many of our partner organisations, the environment, in the social sector and so forth. But particularly one of our young participants earlier today raised the issue of veterinary practitioners as well as medical, other professionals, farmers, NGOs, and so on, in order to make sure that governments take on the responsibility of good government stewardship in this area, and encourage all health actors, support efforts to ensure appropriate stewardship of existing health technology, including drugs, vaccines and diagnostics, and improve coordination of wider advocacy, so that in our community we speak with one voice and we avoid confusing stakeholders with conflicting messages. So that's actually the overview of the statement. And here's some of the organisations who are already signed up to this call for action on antimicrobial resistance, and we're going to encourage you to be part of the call as well. And quite a number of these have been involved in today's effort, as well as signing on to the statement, the call for action on antimicrobial resistance. We wouldn't have been able to do this, so please join us, and I'll remind you once again, secretariat@wfpha.org. If you forget it, you can just go into the World Federation website and find out how to become part of the signatories. But it wouldn't have been possible today to run this conference, and certainly to do it without charge, if it wasn't for BD, Becton Dickinson, Merck, the University of Geneva, FIND, and a series of our other sponsors. They are the main sponsors. There were some other smaller sponsors, including a number of public health associations, and we really appreciate the contribution that they've made. Can I hear a round of applause for those sponsors? The World Federation has an upcoming event tomorrow, and we have finally established within the World Federation Indigenous Working Group. Let me, as an Australian, particularly point out to you that my children, when they were born, if my grandchildren, actually it's a better example, were to be born, I'm waiting for grandchildren. If my grandchildren were born today, they have a life expectancy that is 12 years longer than if an Indigenous counterpart has his or her grandchildren born at the same time, and that's an appalling situation. It's not just in Australia, that is repeated in New Zealand, in Canada, America, and internationally. For those from Europe, it's a similar story, although not identical, with Roma. And so the World Federation, coming out of our global conference in Melbourne in 2017, developed this Indigenous Working Group. And the launch of the working group is here in the University of Geneva, actually, I think in another room just along here, just behind me actually, tomorrow. The launch will be made by an Australian minister. That launch is actually done by video. The Honourable Ken White is an Indigenous man himself, and he's responsible for aged care and also for Indigenous health in Australia, and has made a contribution to that Indigenous working group. So if you haven't registered to attend that, and you know nothing about Indigenous health and the gap and what we need to do for 350 million people worldwide who are seriously disadvantaged, it might be worth coming along and having a listen to that. And then from 3 to 4, having what Australian Aboriginal people call a yarn, so which is a sitting around discussion and so forth. Finally, I'd like to just do a last couple of thank you. I thanked our sponsors as appropriate. The World Federation of Public Health Association staff, we've a tiny staff, and I like to think of us as the mouse with laws, because the tiny staff do just so much work. They're granted, they are supported by over 100 organisations worldwide and jointly with over 1 million members. But the work that's been done, particularly by Dr. Marta Lamazzi, by Professor Borish, and by the staff, Eleonora Takata, who Dr. Takata is here with us as well, is brilliant. Can we please have a standing ovation for her? And finally, today has been so successful, more than meeting our expectations, that we have determined that we'll run a similar workshop next year, but the one next year will be on vaccination, and we'll narrow down exactly what we're going to do on vaccination, but we're open to ideas using the same website. If you want to inject the ideas, we'd love to hear from the same sponsors. We'd love to hear from other sponsors as well, because it is an opportunity to also have people understand why it is that you're engaged and involved in these things. What a great day. Thank you very much. We've all got something to think about.